Good afternoon, everyone. On behalf of the Center for the Study of Social Policy and the University of Houston Graduate College of Social Work, I want to welcome everyone to this important and we hope very impactful convening. The mission of the Center for the Study of Social Policy, which I lead, is about working to build a racially, socially, and economically just society where all children, youth, and families thrive. CFSP has a long history of engaging in child welfare reform efforts and tackling racial inequities in these systems. For decades, we've supported communities working to improve and to promote the health and well-being of children, youth, and families. And we work with policymakers to design public policies that are intended to be more impactful and equitable and supportive of families. CSFP has also been engaged for almost a decade in internal examination and work with partners in the field to define what we mean to be as an anti-racist organization. We've been learning how to use our privilege as a national organization to address systemic racism and its devastating effects on children, families, and communities. For too long, CFSP and others in the child welfare field have worked to reduce racial disparities and remedy the trauma that children experience when they are separated from their families and placed into care. And despite good intent and multiple reform efforts, we have had very limited success. So we believe that now is the time and the opportunity exists to join with others to raise the decibel level on the need for radical change to dismantle the systems that are not working for children, families, and communities, and to reimagine how our collective efforts and financial investments should be redesigned to achieve just outcomes for children and families in need of support and assistance. The road to abolition is not intended to dismantle child welfare system and leave nothing in its place. As we will hear from others today and tomorrow, abolition is about creation as much as about tearing down. So with this brief welcome, I want to turn the day over to Kristen Weber, CSP's Director of Equity, Inclusion, and Justice, who will be our host for today. Kristen has been working in close partnership with Dean Alan Dettlaff and colleges at the University of Houston Graduate College of Social Work to launch the upEND movement and plan the symposium. I want to thank them both for their leadership, and CSSP is honored to be on this journey, collaborating with each of you on this road to abolition and imagining better futures for all children, families, and communities. Thank you.
Thanks, Judy.
You're welcome.
So as Judy said, I'm Kristen Weber, and I'm Director of Equity, Inclusion, and Justice at the Center for the Study of Social Policy. We are so excited to be together with all of you at this virtual event, Upending the Child Welfare System, the Road to Abolition. And this is also the last in a three-part series at the University of Houston Graduate College of Social Work that explores abolition theory, vision, and practice. And if you've missed the first two events, I highly encourage you to go back. They're wonderful events, and they feature conversations with abolitionists Ruth Wilson Gilmore and Derica Purnell. You can watch those anytime on the University of Houston Graduate College of Social Work's YouTube channel. So, originally, we had hoped to host this event in person in April of this year, but, and it's a big but 2020 had other plans for us all. And although we had to rethink and replan this convening, we are now able to actually have this conversation with a much broader and larger audience, for which we are grateful. And although we're coming together in the digital space, we recognize that regardless of where we currently sit during these sessions, most, if not all of us, are sitting on stolen lands, that the upEND movement stands in solidarity with Native and Indigenous efforts to challenge the ongoing project of settler colonialism. And beyond taking this moment to acknowledge the land that we live and work on, we also hope that you recognize and support Native and Indigenous efforts to organize and challenge settler colonialism. So we're launching the upEND movement at a time when over 400,000 children across the nation, disproportionately Black and Native children, are separated from their families and placed in foster care. We know that the removal of Black and Native children from their families has a long, troubling, and racist history. With roots in slavery and the decimation of tribes and Native culture, the persistent separation of Black and Native children from their families is influenced by pernicious stereotypes of Black and Native parents and entrenched systemic racism. The upEND movement seeks to rethink this state-sanctioned separation as a response to social problems like food insecurity, poverty, lack of affordable and safe housing, and lack of meaningful prevention services, just to name a few. We want to be clear. The upEND movement is a call for the abolition of child welfare systems as they currently exist, but it is not an abandonment of the need and desire to protect the health and safety of children and their families. To many people, and we hear it from a lot of people these days, the word abolition is troubling and we believe a misunderstood concept. So we hope to take some time in these 2 days to unpack abolition more fully. We have written about this over the last several months, and I will say it here now. By abolition, we mean both the elimination of the current child welfare and foster care systems, which are built on a model of surveillance and separation of families, and a fundamental reimagining and recreating of the ways in which we support children, families, and communities. We're not naive. We know abolition will not happen overnight. We know this is a process, which is why we have called this convening the road to abolition. There must be a progression of both imagining and building infrastructure for care within families and communities, as well as a shifting of power out of the exclusive control of child welfare to communities. And by communities, we do not mean recreating child welfare systems with privatized community-based systems. This call for abolition is not a new one, and we enter this space as humbly as we can and acknowledge that the work that advocates and parents have been doing this work long before we've entered this space. But the work ahead must be collaborative and led by families and youth who've been impacted by the system, and we join them and many others in the work to build a new future, a new vision for the safety and care of children and families outside the confines of oppressive and carceral systems. It is time to have a candid, open, and loud conversation about the repercussion of our country's racist history and the systems that racist history has created or contributed to in an effort to handle larger societal challenges. It is time to engage in this work in ways that are anti-racist and intersectional. Over the next 2 days, you will hear from a broad group of people who will share their work and ideas for moving us collectively forward. Our panelists and speakers are all deeply involved in this work, and we've encouraged them to pursue the frank, candid conversations that will move this work forward and not to hold back or feel censored. To achieve progress and real lasting change, we must engage in authentic dialogue with one another. Each of us has a contribution to make to stop the harm of family separation and support and protect children and families. So today we will hear from our partner in this work, Dean Alan Dettlaff at the University of Houston Graduate College of Social Work, followed by a short break. And then we will be joined by Lisa Sangoi from Movement for Family Power. And we will wrap up our day with a panel of organizers and activists working in community. We encourage you to use the chat functions in Facebook or YouTube to ask questions throughout the sessions. While we won't be able to answer all of the questions, we hope that we'll have time for Q&A after nearly all the sessions, and we'll take as many questions as we can. And just a few technical notes as we get started. Closed caption and multi-language subtitles will be available after the virtual event has concluded. We have provided information needed to turn on caption and subtitles in the comment section of both the live streaming YouTube and Facebook events. Additionally, there's a program for this event that has the full 2-day agenda, information about the speakers, much more detailed information that we'll probably give you. So we encourage you to go to that program, and ways that you can get involved and support the upEND movement. Links to the program are available in YouTube and Facebook events. And if you can't find the link, just add a comment and someone from the upEND team will share the link. Finally, we will be using hashtags. We'll be using the hashtag upEND and hashtag upEND movement on Twitter to share and discuss the convening. We invite you to join the discussion there and in the chat feature of the platform on which you're currently streaming the convening. So now with that, I will turn it over to our esteemed colleague, Dean Alan Dettlaff, who will talk about the history of racial disparities and disproportionality in child welfare, and how that history leads us to this call to upend child welfare. So thank you, Alan.
Thank you, and good afternoon, everyone. I'm very happy to be part of this convening today. Very happy to see so many of you here. I thought I'd start with sharing just a little bit about myself. I started my career in Child Protective Services as a Child Protective Services investigator in the late 1990s, early 2000s. Worked for many years doing maltreatment investigations, and then supervised a unit of child maltreatment investigators for my last year in the system. So I know what the system looks like from the inside, having spent many years inside the system. After I left the system and went to pursue a PhD, I started to study racial disproportionality and disparities in the child welfare system, and became very involved in the state of Texas efforts to address disproportionality. At that time, this was about the mid to late 2000s. So I was very active in efforts to address disproportionality, and then saw over time how those efforts started to stall, but continued to do my research about racial disproportionality and disparities in the system. And I'm going to share a lot of that with you today. So if we could get the slides loaded, we'll get started. Thanks. So as a bit of framing of the issue, before we get started, racial disproportionality is something that's been observed in the child welfare system for over 50 years, but persists as a national problem. We've known about this for a long time, but due to a debate that's been occurring in the field over about the last decade or so, which we'll talk about later today, many of these efforts to address disproportionality have stalled, and what we've known has been a problem in the child welfare system for decades now remains unresolved. And that disproportionate involvement for Black and Native children results in disproportionate harm. And the failure of the system to address that perpetuates that harm. So we believe now that given the inability of the system to address this, it's time to consider a new framework that really reimagines how we care for children. So what we're going to talk about today is we're going to review what we know about racial disproportionality and disparities in the child welfare system. And then we're going to look at evidence of the harm that results to children and families from child welfare intervention, and particularly the disproportionate harm that results to Black and Native children and families. Then we're going to introduce the upEND movement and why we believe that abolition is necessary to end the harm that results from child welfare intervention. And then, as Kristen mentioned, we should have time for some discussion and some question and answers. So to start out with an overview of racial disproportionality. Oops, let me go back. Racial disproportionality in simple terms refers to the state of being out of proportion. So in the child welfare system, racial disproportionality occurs when the proportion of one group in the child welfare population, and we usually refer to children in foster care there, is proportionately larger, meaning overrepresented, than the same group in the general population. And disproportionality in the child welfare system has most significantly impacted Black children. Black children represent right now about 23% of children in foster care, although they only represent 14% of children in the general population. So Black children are very overrepresented in the child welfare system. And then racial disproportionality also exists among Native American and Latinx children, but to a lesser degree and with some variations by state. So let's take a look at some statistics about disproportionality right now. You can see here that Black children are the blue bar on the bottom, and you can see that they're 14% of the population, 21% of children who are removed from their homes, and then 23% of children in care, so overrepresented. And then that proportion goes down when we look at exits. So there are fewer that exit. If you look at white children, the green bar, you'll see that they're about 50% of the general child population, but only 44% of children who are in care, so they're underrepresented. The same is the case for Latinx children, who are about 26% of children in the general child population nationally, but they're only 21% of children in foster care. So Latinx children are also underrepresented. But as I mentioned a minute ago, we're starting to see a lot of patterns of overrepresentation for Latinx children in certain states. Right now, as of 2018 data, Latinx children were overrepresented in 20 states, although at the national level, there's an underrepresentation. And then you can barely see it, but the small bar at the top, the light blue bar, represents Native children and families. Native children and families are also overrepresented in the system. They represent about 1% of the population, but 2% of children in care. So they're represented at a rate about double their proportion of the general population. So at the national level, disproportionality has most significantly affected Black and Native children. And then racial disproportionality exists because of racial disparities that occur along the child welfare service pathway that impacts both entries into the system and exits from the system. And we know that starting with the initial point of a hotline call to the system, Black children are more likely to be reported for suspected maltreatment. They're more likely to be involved in a case that's confirmed or substantiated for maltreatment. And then Black children are more likely than white children to be removed from their homes and placed in foster care, whereas white children are more likely to receive services in their homes. Once in care, Black children spend longer time in foster care and are less likely to exit to reunification than white children. So at every step in the service delivery pathway, we see that Black children are overrepresented in these outcomes. It's important to point out before we talk about why racial disproportionality and disparities exist that the presence of disproportionality and disparities is not under debate at all. Racial disproportionality and disparities exist at the national level for Black children. They exist for every state in the country. And these disparities have been documented at every service decision-making point along the service delivery pathway. So the presence and existence of racial disproportionality and disparities is not something that's up for debate at all. Where there remains debate is what causes disproportionality and disparities. And I want to spend a few minutes talking about how historically we've come to talk about this. Historically, as I mentioned, racial disproportionality has been observed for more than 50 years. It first came to attention in a publication called Children of the Storm, Black Children and American Child Welfare back in 1972. And when we first started to understand about racial disproportionality in the system, much of what we understood about it came from what we knew about data on child maltreatment from national incidence studies of child abuse and neglect. National incidence studies for child abuse and neglect are a federal effort that's an attempt to try to understand the prevalence of maltreatment across the United States. So not just cases that are known to Child Protective Services, but national incidence of child maltreatment. And prior to 2010, the NIS, the National Incidence Studies, had been conducted 3 times, 1980, 1986, and 1993. And each of those studies showed that there were no significant differences in rates of maltreatment between Black children and children of other races. But at the same time, we knew that Black children were very overrepresented in foster care. So we believed that there must be a problem with racism, with racial bias in the system, because we know that rates of maltreatment don't differ, but still we're seeing this huge overrepresentation. So that must be resulting from racial biases. That then was challenged in 2010, so starting about 10 years ago, we started to see critiques of disproportionality. The first one came from a paper that was written called The Racial Disproportionality Movement in Child Welfare, False Facts and Dangerous Directions. And this paper contended that disproportionality occurs because Black children are in fact maltreated at higher rates than other children, and as a result should be in foster care at higher rates. So the paper went through and critiqued these national incidence studies and said that because of flaws in the way that that data was collected, we didn't really know that their data wasn't accurate, and Black children were in fact maltreated at higher rates. A couple quotes from that article say, one, focus on the claimed racism of child welfare workers puts attention on a non-problem while ignoring the real problems of the Black community, the societal legacy of racial injustice, and the miserable socioeconomic conditions that characterize too many Black lives. And then the paper went on to say, if Black children are in fact subject to serious maltreatment by parents at higher rates than white children, it is in their interest to be removed at higher rates than white children. That received some pushback from many of us, many scholars in the system, because what we knew from the national incidence studies and what many of us who worked in the system had observed in terms of the way that biases operate in that system. So there was some resistance, but shortly following that paper, we saw released findings from the most recent version of the national incidence studies, the NIS4, which was released in 2010. Which found for the first time that rates of maltreatment for Black children were in fact significantly higher than those for white or Latinx children across several maltreatment categories. The authors of that study said that the differences that we were seeing now between Black children and other children were the result of, one, greater precision of the NIS estimates, as well as an increased income gap between Black and white families since the NIS3. What we saw is that data from the NIS4 showed that children in low socioeconomic status households experienced maltreatment at a rate more than 5 times the rate of other children. And Black families are more than twice as likely as white families to be living in poverty. So we see that there, what arose from the national incidence studies was some pushback to the efforts to address disproportionality by saying what we see now is that Black children are in fact maltreated at higher rates, largely because of poverty. We saw a number of additional studies come out specifically related to showing the strong connection between poverty and maltreatment. So where we're at now, or where this has been over, say, about the last decade, is that there's been an issue from those who contend that racial disproportionality is largely the result of racial biases, or largely the result of disproportionate need among Black families. And there's those who contend that although we know that poverty is a significant driver of maltreatment, that doesn't negate entirely the role of racial biases. And what we know is that research supports both of those views. Research supports that poverty is a strong contributing factor, but research also supports that racial biases impact the decisions that are made in child welfare systems that lead to the overrepresentation of Black and Native children. So what we see, though, is that those who have really contended that disproportionate need is the primary factor and that poverty is driving disproportionality will say that there is no bias in the system. Racial bias is not a problem in the system, and in fact are very critical of efforts to try to address disproportionality through things like anti-racism training or cultural competence training, and will say that those kind of trainings are not necessary because racism, racial bias isn't a problem. The result has been that many child welfare systems have been confused about what to do. They're not sure about how to address disproportionality. And they've been led to believe that what causes disproportionality, poverty, is something that lies entirely outside of their system. So if there's no problem with racial bias in the system, there's nothing that they need to do. So what we've seen then over the last 10 years or so is that many efforts to address disproportionality have stalled. Because people believe that the problem of disproportionality exists outside of child welfare systems. So now I want to spend some time talking about why racial disproportionality exists. As I mentioned, research supports both views of disproportionate need and of racial bias. What we know from the literature is that there's really 4 main theories based on available evidence that result in disproportionality. Disproportionate need, as I've mentioned, resulting from poverty. Racial bias among child welfare staff and mandated reporters, as well as institutional racism in the policies and practices of child welfare agencies. child welfare system factors, including a lack of resources to address the needs of families of color, and then geographic context, things like neighborhood conditions, concentrated poverty. So what we see is there's things inside the system and there's things outside of the system. What's important to point out is that whether disproportionality results from factors outside of the system or from factors inside of the system, they result from a common underlying factor, structural and institutional racism, both within child welfare systems and outside of child welfare systems. So if we look at the external factors, this is a great chart that was developed by a colleague of mine who's part of the upEND movement, Reiko Boyd. Reiko, if you're watching, thanks for this great slide. And you can see here, when we think of these external factors, when we think of things like poverty, geographic context, it's important to look at this through a historical lens, starting with the kidnapping and enslavement of people from Africa, going back to 1619, and everything that resulted following the end of slavery. Policies that were created for the specific purpose of maintaining white supremacy and maintaining the oppression of Black Americans. From the Black codes to Jim Crow laws to redlining to the way that the GI Bill was implemented, all of these things were designed to maintain white supremacy. And as a result, resulted in what we see today in terms of things like a wealth gap and an income gap between Black families and white families. So the poverty, or the greater likelihood of Black families to live in poverty today, is a direct result of the historical legacy of racism in this country. When we look at things like health and stress, we know that the daily experience of racism that Black families and other families of color endure actually leads to decreases in their physical health. We know that because of redlining and residential segregation, all of those things have resulted in some of the neighborhood conditions that contribute to maltreatment. So all of the external factors that contribute to this greater likelihood of maltreatment happening among Black families are the result of the historical legacy of racism in America. But then it's important to look at what we know about how racial biases operate inside the system. And we do have a great deal of evidence of racial biases inside the system. I was fortunate to work in the Texas child welfare system on many of their studies examining disproportionality in the 2000s. So I want to just briefly talk about a couple of their studies because they were important and did provide some really good evidence about how bias operates. So we looked at two decision points. We looked at statewide data, over 176,000 cases, and we looked at racial disparities at the point of substantiation or confirmation of whether abuse or neglect occurred, and then the removal decision, whether some type of intervention needed to occur, and then whether that intervention needed to be removal. So we looked at whether the case was opened or closed, and then we looked at if the case was opened, did the case need to be removal or could in-home services be provided? And what was important about these studies is that we were able to control for the effects of family income as well as caseworkers' assessment of risk. So we were able to hold both income and risk constant to try to see whether and the extent to which the race of the child was impacting these disparities. And what we found is that when controlling for both poverty and risk, Black children were more than 15% more likely than white children to be involved in a substantiated or confirmed case of maltreatment. And then again, when controlling for both poverty and risk, among just maltreated children, Black children were 20% more likely than white children to be involved in a case that's open for services. And of those cases open for services, Black children were 77% more likely than white children to be removed from their homes in lieu of receiving in-home services. And the only factor that explained those differences were the race of the child, which is strong evidence suggesting the role of bias in the decision-making, in the decisions that were being made. I think it's important to look at this slide too, because we were able to look at risk scores that were assessed by child welfare caseworkers. So at the time in Texas, risk was scored on a Likert scale type instrument where there were 7 risk factors that were scored on a scale of 1 to 5. So 5 being most extreme risk, 1 being little or no risk. So the highest score a family could receive was 35. The lowest score they could receive was 7. What you see here is that Black families' risk assessment scores are the light gray bar. White families' risk assessment scores are the dark gray bar. What you can see is that in every case, both high income and low income, whether the case was closed, open for in-home services, or removed, Black families were assessed as having lower risk than white families. But as we just talked about, Black families were 77% more likely to be removed than white families. And what that told us is that caseworkers had a different threshold for taking action, meaning risk had to be much higher in white families for a caseworker to justify the need for removal. Whereas in Black families, the risk would be much lower and they would still think that removal was necessary. So again, strong evidence of bias operating in child welfare systems and impacting the decisions that are made in child welfare systems. So now, why is this a problem? I think this is the important part to talk about, what we're seeing in child welfare systems. What we see is a system that is disproportionately surveilling and separating Black children from their families, and then subjecting them to an intervention that we know causes harm. So I want to spend the next few slides talking about that. We know that beginning with the initial act of family separation, there's an entire body of research that shows that that act of forcible separation of children from their parents is a significant source of lifelong trauma. And we know that from research, not just in the child welfare system, but research regarding parental incarceration, when children are separated from their parents through incarceration, when children are separated from their parents through death or divorce, and when children are separated from their parents by immigration enforcement. We know that that act of family separation causes significant trauma for children. That trauma has been shown to be associated with cognitive delays, increased aggression, poor educational achievement, adverse health outcomes, including things like hypertension, difficulty sleeping, obesity, diabetes. All of these problems result from family separation. So the trauma of child welfare intervention starts immediately from that first act of involuntary separation. But then following that, we know that children who spend time in foster care are more likely to experience a host of adverse outcomes. Specifically, there's been a number of important studies that have been done that have specifically compared children who were removed from their homes to children who had experienced similar forms of maltreatment but remained in their homes. And what we saw is that among children who experienced similar forms of maltreatment, children who were removed from their homes in lieu of receiving services inside their homes had 2 or 3 times higher delinquency rates, higher teen birth rates, lower earnings as adults, were twice as likely to have learning disabilities and developmental delays, 6 times more likely to have behavioral problems, more likely to have substance-related disorders, psychotic or bipolar disorders, depression, anxiety, and had arrest rates 2 to 3 times higher and were more likely to have criminal convictions for violent arrests. So we see that time in foster care, the intervention of foster care itself, results in significant adverse outcomes for the children who spend time in foster care. It's important to point out here that the harms that result from foster care are harms that result for all children who spend time in foster care. But the risk of experiencing those outcomes is exacerbated for children of color due to the ongoing legacy of racism and inequality in America. What we see is that Black children in America are already at risk of poor outcomes over the course of their lives because of the daily experience of racism that they have to endure. So Black children in America are already at risk of economic hardship, poor health, low educational attainment, teen births, criminal legal system involvement, emotional distress, suicidal ideation. When we then add the trauma of forced separation and placement in foster care on top of those risks, we're making it all the more likely that those children are going to experience those adverse outcomes. So in this way, the system itself becomes a source of maintaining the oppression of Black children and adults, which is why we get to the upEND movement to abolish the child welfare system. So why upEND? We need to upEND the system because we know that decades of research have documented not only the existence of racial disproportionality, but the harmful effects that result to Black children and families because of disproportionality. And despite decades of reforms and attempts to address this, racial disproportionality persists. The system has tried for decades to reform, has tried to address the problem of racial disproportionality and the harm that results, and they've been unable to significantly address that. So given that inability of the current system to address that, it's time now to look at new frameworks that reimagine how we care for children. And we believe that needs to be a framework that's fundamentally anti-racist. So what is anti-racism and what is an anti-racist framework? Anti-racism is a practice that opposes institutional and systemic policies and practices that produce and maintain racial inequities. So when we apply an anti-racist framework to the child welfare system, that starts by acknowledging that racial disproportionality and disparities exist because of the policies and practices of the system, within the system, that maintain them. So what we see right now is that the system tries to react to disproportionality. The system tries to address the problem once it exists. An anti-racist framework asks that we shift our efforts from trying to reduce or address disproportionality once it exists to looking at the policies and practices that create disproportionality and trying to remedy those. And in the child welfare system, we know that the policies and practices that create racial disproportionality are the policies and practices that support the involuntary separation and removal of children from their parents. So why upEND? Because we know that reforms are no longer sufficient. Eliminating racial disproportionality and disparities and the harm that they caused will only be achieved when the forcible and involuntary separation of children from their parents is no longer viewed as an acceptable form of intervention. The harm that results from racial disproportionality and disparities and the families that are destroyed as a result will only end through abolition of the current system and a fundamental reimagining of how we support child, family, and community safety and well-being. So what is the upEND movement? The upEND movement is an emerging collaborative movement that looks at first ending the use of involuntary separation of children from their families, and at the same time, increasing meaningful supports so that families and communities can care for their children. What we seek to do is to rethink state-sanctioned separation of children from their parents as a response to things like social problems, like food insecurity, poverty, lack of affordable and safe housing, lack of meaningful prevention services. That's what the upEND movement is about. As Kristen mentioned in her intro, we know that abolition, the concept of abolition, is often misunderstood, confused, scary for some people. It's important to point out that abolition of child welfare doesn't mean abandoning the need to care for children. It means new ways, building new ways of protecting and supporting families while dismantling the coercive systems of surveillance and punishment that exist in the current child welfare system. We also know that abolition is a process. Abolition isn't going to happen overnight, but abolition requires that we start now to actively dismantle the racist policies and practices that exist in the current child welfare system and create new anti-racist policies and practices that provide what families need, that provide the resources that families need so that all children can remain home safely with their parents, with their families. And abolition also requires a shift of power. Abolition requires a shifting of power from institutions of social management, like the child welfare system, to communities. So that's what we mean by abolition. Abolition is about creating new ways of supporting families so that they have the resources they need so that they can stay with their families and communities without the need for forcible separation. This work is also about reimagining. And reimagining is a process of co-creation with community organizers, parents, youth advocates, and this is what we're going to be spending the next couple days doing today and tomorrow. Reimagining systems of support so that families have access to the resources they need. Creating and improving systems of community-based support that provide things like a child allowance, safe and affordable housing, jobs that pay sustainable wages, mental health services, food, all of the things that we know families need. So what will reimagining look like? All families have the concrete supports they need. We know that there's an entire body of research that shows that just a moderate amount of financial assistance significantly reduces maltreatment and contact with child welfare agencies. So that's what we're wanting to reimagine. If we can significantly divest from the child welfare system and all of the funds that go to support the maintenance of foster care and use those funds to give families what they need to be safe and healthy, we won't need foster care. We can eventually get to the place where foster care, or the need for foster care, is obsolete. So all families having the supports they need, residents of communities intervening when something is needed. What we envision is a system where when a family is in crisis, families and communities are first responders, not the government. We view communities who have experienced recovery providing supports to those who need it. A system of community supports that can minimize and address harm. That's what reimagining is about. So I want to close here and take some time for questions with this quote from Ruth Wilson Gilmore, which I think really sums up what abolition is about. Ruth Wilson Gilmore says, "Abolition is a way of seeing. Abolition makes you ask, when you look, what are you seeing and what would you rather see?" What we see now, when we look at the child welfare system, is we see a system that disproportionately surveils Black and brown bodies and Black and brown communities. We see a system that forcibly separates Black and brown children from their parents. We see a system that responds to need with an intervention that inflicts further harm on children and families. And we see a system that acts as an agent of oppression. We don't believe it needs to be this way. So what we're going to be doing the next few days is talking about what we'd rather see. And I'm really looking forward to hearing from many of our panelists over the next couple of days about what we would rather see and how we can get there. So I think we're going to take some time now for some question and answers.
Hi, Alan. Thanks so much for the presentation. So we have the chapter on fire, which we are thankful for, and that I'm glad that you're talking with one another, and encourage you to keep talking with one another, and not just Alan. And we are also learning from you and with you. So thank you so much for those of you who are sharing resources and other information. I also want to take the time, it's important to acknowledge in the chat, there was a lot of questions or concerns or information around lack of data and conversation around Native and Indigenous communities. And we do have a panel tomorrow where more of that will be addressed by folks who are deeper in that work. And so the other thing, I did some technical pieces. Alan, lots of people are asking for your PowerPoint. That will be able to be shared. His PowerPoint is resourced up. That will also be available both at the University of Houston's Graduate College of Social Work, but also at upEnd's movement.org, our website, shortly after this convene. So Alan, some questions should be coming very soon. Here you go. So this one is from Victoria Copeland. Thanks, Victoria. We have to engage with the current ideology of child protection. Violence has occurred in the name of safety, permanency, and well-being, proliferated through our laws, practices, risk assessments, etc. So it's a comment, but I thought that we were seeing some of this also in the chat, the concept of child protection and the concept that abolition ignores child protection. So I just wanted to get your reaction to that.
Yeah, I think, what on those last few slides, I think it's important to point out that abolition isn't just about the ending of foster care. Abolition is about the creation of new ways of protecting children. As I mentioned, what we know is that much of the maltreatment that we see is a result of lack of financial resources that families need. And if we could rethink the way that we allocate resources in this country to give families what they need. First of all, what we know that nationally, more than 60% of protection that happens, more than 60% of removals are the result of neglect. And we know that neglect is largely a function of poverty. So right now we have a system that takes children from their parents and places those children in the home of a stranger, and then pays that stranger money to take care of somebody else's child. In Texas, the state pays foster parents $700 a month to take care of a stranger's child. What if we just gave that $700 a month to the parent who's struggling to meet their child's needs? We wouldn't have a need for foster care and state intervention. So that's what this movement is about. It's about looking at ways to reallocate how we use our resources. Because I'd say that removal is violent in itself. What we do right now is we respond to situations with violence. The act of forcible family separation is violent, and that's what we're trying to reduce.
Thanks, Alan. So this one is from Larkin Tackett, who, full disclosure, is a member of the board of the Center for the Study of Social Policy. So hi, Larkin. So either or thinking is from white supremacy culture. How do we help people in child welfare understand, act on research that disproportionality is from both disproportionate need and systemic racism?
I think it's important to focus on what we know from the research. As I said, research supports both. There's disproportionate need or just poverty resulting in maltreatment. There is much literature and research that supports that. We know that poverty is the most significant contributor to child maltreatment. And we know, as I mentioned, because of a legacy of racism and structural inequality in this country, Black children and families are more likely to be living in poverty. So that's the reason why we see higher numbers of maltreatment. But we also know that there's much research that shows the presence of racial bias in systems that impact decision making. I think it's important to also point out, I talked about a couple quantitative studies that showed suggest evidence of racial bias. There's also an entire body of qualitative research with Black families, with Black youth, that document their experiences of racism in the system, that document their experiences of racial bias that impact the decisions that are made about those. We often don't talk about that research, or the researchers who support the concept of disproportionate need and suggest that racial bias is not a problem, often don't talk about that large body of qualitative research. That's an act of oppression in and of itself, because it's saying that the voices of people with lived experiences isn't worthy, isn't good enough data, so therefore we're not going to talk about it. I believe that that qualitative data is incredibly important because it's documented people's experiences of racism in the system. So we need to answer the question, we need to focus on what we know from the research, and we also need to value the research that's done that includes the voices of the families and children who've experienced the harmful effects of the system.
Thanks, Alan. So this is from John. Why did these studies use euphemisms like maltreatment rather than the actual harms that are inflicted?
I'd say it depends on the study. I think maltreatment has been used as somewhat of a catch-all term to include physical abuse, sometimes neglect, other forms of abuse. So I think it depends on the study. There's some studies that focus specifically on physical abuse. There's some studies that may focus specifically on certain times of neglect. But I think maltreatment is used as a broad term by many researchers. But I think, to the point, it would be better for researchers to use the more specific terms that define what they're talking about.
Thanks. So here's a comment from Aaron. Over the last couple of years, I've really become concerned with the use of risk as a relevant measure.
Yeah.
Let's talk about risk.
Yeah, that's a really important comment there. So thanks, Aaron, for asking that. And it's important because risk is assessed by another human who comes to the table with their own biases about what's risky. I think I'll tell a quick story about some of the work I did in Texas to kind of demonstrate how risk can be used sometimes. In Texas, we did a study that looked at removal affidavits. And a removal affidavit is an affidavit that's written by a child welfare worker to present to a judge to justify why they have to remove the child. And we compared these removal affidavits between affidavits that were written with white families and affidavits that were written with Black families. And what we saw in the affidavits for the white families, and again, these are short, a page and a half, 2 pages max. The caseworkers would talk about the very specific things that they believed to be risk, as well as the specific details of the abuse. So a linear skull fracture, a second-degree burn. And then they would talk about things that they believed to be risks, like the presence of domestic violence, substance use in the home, things like that. When we looked at the affidavits of the Black families, what we saw is that caseworkers were including a lot of other information. They were saying things like, there was a strange man standing on the street corner as I pulled up to the house. There were children running around in the street with no shoes. There was a man sitting on the front porch drinking a beer. There was a pit bull in the backyard. None of those things have anything to do with risk for maltreatment, but yet the caseworker felt it was important to paint this picture for the judge about what they believed was risky. That's how risk, the concept of risk, can be used as harm, or can cause harm when it goes unchecked like that, because it's biases that impact caseworkers' perceptions of risk.
Thanks, Alan. This is from G. Samuels. There are so many committed, dedicated people working in child protection today. What would we rather see them doing? How may they be reoriented?
Yeah, I think that's really important to point out. As Kristen mentioned in the beginning, we've had this great series where we featured Ruth Wilson Gilmore, Derek Purnell talk about abolition. And I remember Ruth Wilson Gilmore talking about the defund the police movement, which has many parallels to this movement. And she said, many people believe that defund the police is a massive unemployment program. And that's actually not what it is at all. I'm perfectly fine with, I think we're fine with people keeping their salaries, but using them for other purposes. I would rather see people working with children and families, not in the existing child protection system, but working with families to provide them with what they need to be successful, providing them with the resources that they need to be successful. So I think a lot of this is community-based or community-led and community-driven efforts to support children and families may still involve the use of social workers to help families. But I think that needs to be done through community-based organizations that don't have the power to remove your child from you. That's, I think, the difference. There can still be social workers, caseworkers working with children and families and helping them be successful, but doing that through community-led supports that don't have the power to take their children from them.
Thanks, Alan. This is from Beverly. How do you engage the judges, lawyers, and justice system that's part of this racist system?
I think that's a really important part. I think that often when we talk about this work, we talk about child protection caseworkers and supervisors. The judges actually play an incredibly important role because they have decision-making power over whether a removal can occur. They have decision-making power over when a child can be returned to the home. So I would really like to see judges engaged in this work and have judges feel empowered to push back on the system. I think judges sometimes believe that people in the system are well trained, they're presenting accurate information, and that they're the ones who are the experts and they're the ones who know whether a removal can occur. I'd like to see judges push back. I'd like to see judges at these 24-hour or 48-hour removal hearings say to the caseworkers, what have you done to try to prevent this removal? Prove to me that this removal is absolutely necessary. When a child is removed and then the caseworker goes back to court, say 3 months out, to justify why the child needs to stay in care, I'd like the judge to say to the caseworker, tell me what's happening right now today that is jeopardizing this child's safety should the child be returned home. Because often what we see is caseworkers will say things like, well, the parent hasn't completed their parenting classes yet, they haven't done this service, they haven't done that service. What's the actual safety concern that's happening in the home right now that you're saying this child can't be returned because of? So I'd like to see judges be much more actively engaged. One, recognize the deep problem of racism and racial bias that impacts decision-making in child welfare systems, and then two, start to push back on that.
Great. So from Kate, how will the voices and experiences of those with lived experience, first families and foster care alumni, adopted people, be upheld in the visioning of this movement? Allyship has the potential to inadvertently silence this population. For example, this is clear in the adoption advocacy world where adoptive parents dominate the narrative.
Mm-hmm. Yeah, I think it's important to continue to point that out for us as we're doing this work. I mean, that's why we're very happy to be working with the Movement for Family Power, which will be, our speaker will be from next. And I think it's important for us to just continuously keep this point in mind, that as we're building coalitions around this work, that it has to include the voices of youth and parents who experienced it. I think you'll see on the panels throughout today and tomorrow, those youth and parents who have been impacted by the system. So we know that it's incredibly important that those voices are part of this work, and we're very committed to making sure that we continue to stay engaged with them and continue to have their voices lead the work. I think that, one of the critiques that Kristen, you and I have gotten over this is, so what's your plan? What are you going to do? And we always say, we don't have a plan yet, because that plan has to come from the voices of the people who experienced that. So our role in this work is to be sure that we're uplifting those voices, and that those voices are a significant part of any further developments that come out of this movement.
So Alan, this is our last question, and then we're going to take a break. But I just want to acknowledge that there are a ton of questions, and we really appreciate people so heavily engaging in this conversation. So this question from Susan: how do we respond when people point to actual physical abuse, those relatively rare cases where it's not a matter of poverty or a need to strengthen families, but actual physical abuse of children?
Yeah, I think that's a really good question, and I'm glad that we have a few minutes to talk about that. First, I think it's important, Susan, what you pointed out, that those are rare cases. I think there's a myth about child protection systems that all of the cases they respond to involve these really severe forms of maltreatment. I think that's, perpetuated in a lot of ways by media coverage. When there's a very severe case of a child that's being tortured or locked in a cage, those things do happen, and then the media responds to those cases, and then they talk about child protective services responding and intervening in those cases. And that creates the incorrect view that that's the bulk of what child protection agencies are responding to, and that's not the case. Those cases are actually very rare. But I think when we look at this case, it's important to acknowledge that, yes, absolutely, there are parents who physically abuse their children. And right now, there's a need for some intervention to be done to protect those children. I think what's important to point out, though, what we often hear in this work is, if you abolish the system, what's going to happen to those children who are being severely maltreated? I think that that's the wrong question to be asking. I think the real question that we need to ask ourselves is, why do we seriously abuse their children? And what can we do to address that prior to it happening? And that's what this work is really about. As we've said, abolition is a process, but we believe we need to start the work now to prevent abuse from occurring in the first place, to prevent the need for foster care placement.
So thanks, Alan, and thank you, everyone. We're going to take a 10-minute break. So we encourage you to get up, stretch, and look away from the screen, but come back in 10 minutes because we have a very exciting keynote from our partner, Lisa Sangoi, Movement for Family Power. Thanks, everyone. Hello, everyone, and welcome back. We're so excited to have you here, and we're very excited for our keynote speaker, Lisa Sangoi from Movement for Family Power. We were first introduced to Lisa through her incredible work that Movement for Family Power does, and we have been following their work ever since. Movement for Family Power is an organization that fights policing and punishment of families through the foster care system, and Lisa is a co-founder and co-director for Movement for Family Power. You can read more about Lisa in the speaker information in the program, which is available on Facebook or YouTube or wherever you're watching this session. So we're so excited to welcome Lisa. Thank you. So I think we're having a little moment of technical glitch. And here's Lisa. There she is. Hi, Lisa.
Hello. Thank you, Kristen.
Welcome.
Good afternoon, everybody. It is an incredible honor to be in conversation with you all today and to share this virtual space with you. I regret that we are not all together in person as was initially intended. And I also want to give gratitude to the fact that despite the tsunami of events surrounding us, the moment that we are in, that we are all able to come together virtually to engage in the ever humbling and ever fulfilling effort to be in joint community and to learn together. As Kristen said, I'm Lisa Sangoi. I use she and her pronouns. I'm zooming in from Washington, D.C., land of the Anacostans. For folks who cannot see me, I'm a South Asian woman with glasses. I'm wearing a black kurta that has white trim. I have on big gold hoop earrings, my favorite red/purple lipstick. I am a co-founder and co-director of Movement for Family Power. Our mission is to end the foster system's policing and punishment of families and to create a world where the dignity and the integrity of all families is valued and supported. We are but one very small part of the much larger, constantly growing movement to divest from and eventually abolish the foster system. We are but one small part of the much larger movement that seeks to reimagine and reclaim how we as a community help ensure family and community safety and well-being. My guess is if you're attending this conference, you are starting to see that this family regulation system, and I will refer to the child quote unquote welfare system as a family regulation system and the foster system interchangeably. You're starting to see that it's racist, it's classist, it's ableist, it's misogynist, it's xenophobic. And that tinkering around the edges isn't really going to change that. You're seeing that we need more visionary change, such as divesting from the family regulation system and investment in family supports. Maybe you're even thinking we need something more transformational. With all my heart and soul, I agree with the families who have been impacted by the system, with the activists, with the researchers, and others calling for reinvestment of money that the state is spending on the foster system into housing, into childcare, transportation, food, healthcare. It's not rocket science. It doesn't need 1 million studies. People just sort of need their basic needs met to live. In our country, more than any other country with a comparable per capita income, does the very worst job of providing for its people. But we, especially those of us with privilege, we need to be accountable to more than just systems change. We need to be accountable to freedom. A free and just future will not be realized in the meetings of technocrats and policy wonks and researchers trying to figure out how best to structure home visiting programs or how to maximize federal Medicaid funds for families at risk. It won't happen if we think divestment is just reallocating funds between systems. The policing of motherhood, of families, of Blackness, of marginalized bodies, of the land, it's baked into the DNA of this country. Shifting Resources between powerful hands just won't get us free. I do not wish to diminish the work many people are doing to keep families at home together. Quite the opposite. I give this work enormous gratitude. This is important work, rigorous work. It is work that makes life more livable immediately for folks in need. But it is not the entirety of the work that liberation and abolition demands. I will say it again, the policing of marginalized people is baked into the DNA of this country. So what does that mean for folks doing the invaluable work within systems to make them less harmful, to make life more livable? It means simultaneously, intentionally, making space for people who will do the liberation work, knowing the difference between your work and freedom work. For example, the Black Panther Party free breakfast program for children was rooted in a radical vision of liberation and self-determination. It is entirely different from the free breakfast program that the federal government operates now, a program that was in fact inspired by the Black Panther Party. These free breakfast programs in schools across the US provide breakfast to tens of millions of children, but they are just fundamentally different, not grounded in the same liberation ideology. People working within systems must not co-opt the analysis, the work, and the vision of those seeking to entirely transform the world. Rather, people doing the work to make life more livable must simultaneously make space for freedom work and share resources with freedom work without diluting its power. We must politicize ourselves so that even if we are doing systems work, we know our North Star is freedom work. This is our duty, and hopefully it will be our survival. I am humbled to tell you I do not have all the answers. Of course, I cannot explain how various efforts for change or reform or abolition of the foster system operate in relation to each other. And of course, I cannot with any certainty chart a path forward. That's for us to figure out together. All of us are so fortunate to live in the midst of legendary freedom fighters who are leading the way by being examples of the work. And let us also not forget we are the humble recipients of a history of enormous freedom struggle. We've been taught some things about supporting the fight for liberation. We've been taught that we must broaden and sharpen our analysis. This is the project of joint learning and value alignment to ensure that work that makes life more livable leads to liberation. We've been taught that to broaden and sharpen our analysis, we must study history. It is not an exaggeration to say that the family regulation system is what follows in a country with the legacy of slavery, where Black wombs and babies were monetized, where white sense of moral rectitude, righteousness, and resilience were all dependent on the existence of the enslaved person. It is not an exaggeration to say that the family regulation system is an outgrowth of a country that is obsessed with its white Anglo-Saxon Protestant roots, a country that has tried to violently assimilate, or when encountering resistance to assimilation, extinguish people, cultures they view in opposition to their construct of morality. Let's look a little deeper into this history. The very first effort in this nation to create a family regulation system was undertaken in the mid-1800s by a white man, a white Protestant man who considered himself a progressive. I won't say his name. He was terrified by the Irish and Italian Catholic immigrant children he saw coming to America in droves. And you must remember that these families were not racialized as white at the time. He felt that decent middle-class society needed to intervene and prevent these, and I will use his words, genetically inferior parents from passing on their ways to their children. So he created a foster agency known as the Children's Aid Society, which spearheaded an effort to ship hundreds of thousands of Irish and Italian Catholic children to Protestant farms where they would serve as indentured and enslaved labor. The Children's Aid Society stole these children from their parents, from their families, from their communities. This foster agency is still in existence today, still doing the same dirty work. It's not an exaggeration to say that the foster system played an instrumental role in the social and cultural genocide of Indigenous families. By the 1970s, up to 2/3 of Indigenous children had been forcibly removed from their parents' home. 2/3. It is not an exaggeration to say that this system is the very system that consecrated heteronormative notions of who gets to be a family, that disregards any organization of people outside of the legal definition of a nuclear family, and relegates our radical care networks as less than, as illegitimate, as unrecognizable. The foster system, at its very roots, is rotten. It's critical that we broaden and sharpen our analysis. We must question the origins and the intents of the system that surround us to ensure that our work truly leads to liberation. We must interrogate our larger political, social, and economic context within which these injustices occur. The foster system plays an instrumental role in maintaining an economic, political, and social order that justifies massive racial and wealth inequality. The system constantly hides and normalizes enormous injustices and power imbalances. Let's take a peek at the broader political and social context. Do you ever wonder why US courts are only worried about delivering justice when it allows them to punish a marginalized person? Take, for example, a South Asian father and his wife who stood with their head hanging before the family court judge. The judge, gazing down at the family, providing his concept of wisdom, uttering, "We don't hit each other here in America. That's not how it's done here. We talk. Domestic violence is bad for the family. It's going to harm your kids and you're harming each other." The judge then uses his power to demand that the protesting wife stay away from her husband until her husband has completed his domestic violence classes, and threatens to remove the children from her if she doesn't. The father looks to the judge and asks, "Where should I live? I've been kicked out of my house. How do I pay the bills? How will I get food to my family?" The judge, who sends commands large enough to rupture families, who is vested with the authority of the state, answers to the father that it's not his concern. The courtroom was concerned with only one kind of harm, the harm this father inflicted on his family. That this father was outraged with his life in the United States, working literally every day for 7 years, yet still barely able to provide for his family, feeling emasculated, humiliated by the violent economic situation he found himself in the United States. This was a no concern to the system. The judge, the court, the system, the country pretend as though they have no relationship to the structural violence, and certainly will never take accountability for it. The family had no forum for justice or healing for the economic violence they had experienced in America. No forum for justice or healing for the centuries of violence at the hands of colonialism and economic exploitation, from which, of course, this country and even this very specific judge had benefited. The only harm that would be the subject of extensive state action was the harm that could be blamed on the mother and father. We must broaden our thinking about these issues and expand the scope of our understanding. Do you ever wonder why the only time the United States courts seem to take action to protect Black and brown children living in poverty from chemicals is when those chemicals are controlled substances taken by their mothers? Meanwhile, our government does very little more than shrug at the environmental degradation caused by multinational corporations. These multinational corporations purposefully operate in low-income and Black and brown communities, and purposefully take safety shortcuts when they know the harm will land on low-income Black and brown folks. The BP oil spill on the Gulf Coast in 2010 vastly disproportionately affected Black families and Vietnamese immigrant families. it will have a far more profound effect on the well-being of those communities than any parent's drug use. Can you imagine if the energy and resources of the $30 billion a year family regulation system were focused on combating environmental degradation and its effect on children and families instead of substance use by Black and brown mothers? Our freedom destination demands that whatever work we do, we ask these questions, study these histories together, or that we get out of the way of people who are doing this important work. We cannot uproot, dismantle, reimagine, and reclaim unless we do so. We must study the body of theory, work, and practice called abolition. Abolition is liberation work. It is work that honors the new future we all deserve. I'm going to share with you now a few things I've learned about abolition. Abolition calls on us to acknowledge structural harm, harm that is otherwise normalized and thereby invisibilized. For example, this country normalizes homelessness, being without a home. This country puts up a smokescreen, blaming people who don't have homes for not having homes, saying it's a result of their mental health or substance use. And this country actively hides one of the very real, much more influential causes of homelessness, centuries of white folks and white governments redlining and draining of wealth from Black communities. Abolition calls on us to no longer accept the invisibility of structural harm. Abolition calls on us to dismantle institutions that were designed to perpetuate structural harm, not just reform them. The foster system is case in point. Equally important to the practice of abolition, as people at this conference have said time and time again, equally important to dismantling is building. Abolition calls on us to build safe, thriving, and happy communities. It is as much a project of imagining or building or reclaiming as it is dismantling. Do you feel that it is hard to imagine a world without prisons and police and the foster system and the punitive welfare state? Look no further than the work people are doing today to build this world. Mutual aid networks that have no work requirements or family caps. Restorative and transformative justice programs that do not rely on cages to not just effectively address harm, but heal harm and interrupt future cycles of harm. These are leading us to the world that abolition imagines. Abolition calls on us to contextualize interpersonal harm within structural harm, thinking back to the example of the father who physically harmed his family. This harm cannot be understood, it cannot be healed, it cannot be prevented unless we also acknowledge the structural framework within which it occurs. And abolition calls on us to approach the person who did the harm and the person who was harmed with equal measure compassion. This is radical love for our people. Abolition calls on us to transform the way we address interpersonal harm. It asks us, what does true accountability look like? What does true healing look like? Because we know the systems we have built to address harm, to heal harm, to interrupt cycles of harm are not working. We know for a fact that the foster system has not reduced the rare cases of serious harm of children by their parents. We know for a fact that the criminal legal system has not actually reduced interpersonal harm. Here, I give enormous gratitude to the work of groups such as Bay Area Transformative Justice, which was shouted out in the comments, Building Accountable Communities, the Ahimsa Collective, AHIMSA, Ahimsa Collective, just to name a few, who are showing us the way. They are doing the enormously difficult and courageous work of addressing harm in our communities outside of the legal system, and they are doing it effectively. I encourage you to learn more about their work. These are just some of the things I've learned about abolition. Abolition can help us understand whether we are working to make life more livable or liberated, and if the former, how to make intentional space for liberation. Now, how do we practice abolition and liberation work? Or how do we be good allies to those doing liberation work? There are so many examples, but here I'm going to quote Mariame Kaba, a legendary activist and organizer. She says that when she is outraged about an injustice, she asks herself 4 simple questions. What resources exist so I can better educate myself? Who's already doing work around the injustice? Do I have the capacity to offer concrete support? And how can I be constructive? So let's do some of this work together. Let's figure this out together, as we should always do. First, what resources exist so that I can better educate myself? Much of the published literature on the family regulation system engages in an enormous amount of pathologizing. If you are reading the literature that is making racist or classist or misogynist or ableist findings, which is how I describe much of the social science literature on the foster system that I have seen, it is probably the wrong literature to read. Let us not allow the dominant literature to drown out the enormous body of freedom literature that is out there. The Shriver Center put out a great syllabus on the injustices of the family regulation system. Elizabeth Brico, a leading expert on harm reduction and the family regulation system, a beautiful mother who herself had her family torn apart by Broward County's family regulation system. Elizabeth has written prolifically about the injustices of the system. Dorothy Roberts, Kiara Bridges. I'm also going to sheepishly shout out a Movement for Family Power 150-page report that interrogates how the family regulation system has become ground zero for the war on drugs, and related work we are doing in New York State to challenge the womb to foster care pipeline. Law for Black Lives, an organization dedicated to cultivating radical politics within Black organizers, lawyers, and legal workers, has a wealth of resources on their website. The INE Institute, an institute for radical social justice movement building, also makes a library of resources and webinars and other things available on their website. Learning is freedom work. Let's learn together. I've just touched the tip of the iceberg, and I know you have so much more to share. Second, who's already doing work around the injustice? No movement for social justice, not the great anti-colonization struggles of the 40s and 50s, the civil rights struggles of the 60s and 70s, the immigration struggles of the 90s and 2000s, just to name a few. Not one struggle has seen meaningful change without the people and communities most impacted by the injustice leading the fight. This is not to say that the burden of combating injustice lies with oppressed people alone. That is not at all what I am saying. Also, to be abundantly clear, this also does not translate into just inviting an impacted person to speak on a panel and providing an honorarium. It is, however, to say that people who are less proximate to an injustice cannot define the fight, the priorities, the strategies, the wins. Those less proximate can and should contribute to creating supported space for those who are more proximate to the injustice. There are a variety of ways people can be allies. Movements need Excel sheets, calendar invites, agendas, cooked food, physical labor, website updating, grant writing, ghostwriting, social media support, newsletters, and so on. These are just a few of the ways less proximate folks can show up. Also fundamental to a movement is that it's people. The activists, artists, academics, journalists, researchers, teachers, healers, organizers, that we are all in healthy, loving community with each other. This is the slow and intentional work of relationship and trust building by showing up and showing up right and showing up humble, of engaging in shared learning and in shared historical study, in building analysis together, sharpening analysis together, aligning our values together, of imagining our destination, of understanding that conflict is natural and generative and that loving conflict resolution grows us, of understanding that everyone has a different role to play in a movement and no one person's role, not the researcher or lawyer, is any more important than another's. For example, the healer or artist. And finally, to address Miriam's last question, do I have the capacity to offer concrete support, and how can I be constructive? This links back to the first question of how do you fit into the movement? And then from there, figuring out both what is your capacity and how to contribute. UINI Institute, the Social Justice Movement Institute I referenced earlier, has done enormous research and writing on this. And I wanted to share a high-level overview of their theories as I understand them. There are folks who do the inside game work, whether it's policy advocacy or producing research within dominant institutions or working within systems as attorneys or social workers. There are folks who are on the outside of systems, organizing our people. There are folks who lead and sustain mass protests. There are folks who are engaged in the important work of healing, because if we are to imagine a free future, we have so much within ourselves that needs healing. There are folks who are building the alternate institutions, folks that are actively imagining right now what our future might look like. Each plays a critical role in the ecosystem of movement building and change. Each person within their role can focus on their work and do their work effectively because someone else is carrying water on another piece of the puzzle. Different people in different spaces tend to judge each other, devalue each other's work. This is a realization I had about my own self within one of UINI Institute's trainings. People doing policy work might think the healers are woo-woo and wasting time, or people building momentum for mass protests may think the policy folks have sold out a little bit. Yet building a healthy movement ecosystem requires recognition that each one of these roles is critical to the movement's success. Each contributor needs to be valued and supported. Foundations and philanthropists. If you look at your portfolio and you realize you're spending all your money on inside game actors, such as policy folks or researchers, think tanks, maybe it's time to think about expanding your support to folks who are doing healing or building alternate institutions. Because without a full ecosystem, we won't get free. I realize that I have presented a lot of ideas, theories, and examples of practice. It may not be clear how everything neatly relates and fits together. At this point in time, I know I have far, far, far more questions than answers. I am in a space of learning, constant space of learning. And I am excited for us to be in loving community together, to build at the speed of trust together, and to figure some of it out together. We are doing work that will last for generations to come. As I close out, I leave you with this quote from Andrea James, Director of the National Council for Currently and Formerly Incarcerated Women and Girls. It is the largest membership-based organization working to end the incarceration of women and girls. It's based in Roxbury, Massachusetts. They are unapologetically abolitionist, unapologetically feminist. I leave you with these words because I have found them to be incredibly grounding in terms of orienting myself in my role in the movement. She writes to an audience of thousands of formerly incarcerated women and girls agitating in their communities across the country. She writes, I continue to encourage our sisterhood to stay on the ground in your local neighborhoods, doing the community building work that can only be led by our people from within our neighborhoods. How we define this work, the narrative that moves it, who it is led by, and the outcomes we need for our communities are just as important as getting the wins that will be hailed as created and driven by big nonprofits. I hope these words will reverberate in your head, creating the force field of a moral compass as they will in mine for years to come. Thank you.
Thank you, Lisa. We really appreciate you, and thank you so much for a wonderful keynote. We're going to take a 5-minute break just to give everybody a chance to digest what you heard, think a little bit, look away from screen, stretch. And when we come back in 5 minutes, we will have our panel with organizers and activists working in community thinking through ideas around abolition, the road to abolition, and pushing the child welfare system to do better. Thanks so much, everyone. See you in 5 minutes. Welcome back, everyone. We're going to start now with our last panel of the day. And thank you so much for those of you who've been able to hang in with us for this day. And for those of you who are watching when this is rebroadcast, we are excited that you're back. So I'd like to welcome Maya Pendleton, a policy analyst at the Center for the Study of Social Policy. Maya's going to, she has, her bio is available in our program if you want to know more about her, but I'll just tell you she's fabulous. And she's going to lead a panel discussion with some organizers and activists who have been doing this work for some time. And the name of the panel is Shifting Power, Building Change. Thanks, Maya.
Thanks so much, Kristen. I could not be more excited to be in conversation with both this panel today and everyone who's watching today virtually. As others have said, this is really about co-creation and really building, especially with those who are either organizing against these systems on the ground or those who have experiences in these systems or both. So today's panel brings just so much knowledge and experience around the family regulation system, and I'm super excited to learn from each of these panelists and be in conversation with everyone today. So I'll stop talking and we'll bring out our panelists. So first I'd like to bring out Tymber Hudson, and I'll let them introduce themselves.
Hi, friends. My name is Tymber Hudson. My pronouns that I use are they and them, and I am located in Pittsburgh, Pennsylvania. I am so excited to be a part of this conversation and just honored to be here, honestly. My entry to the conversation of the road to abolition is really based on my own experience with the foster care system or the family regulation system. And that has really shaped my advocacy, and it has allowed me to grow as a professional as well.
Thank you so much, Tymber. And next we have Alan Michael Graves.
So good morning, here still in Los Angeles. Thank you for having me. I too am excited about being part of this conversation. And was excited when we were told that it was going to be an open and honest conversation. I serve as the director of national programs for the Good+Foundation, which works with about 75 organizations across the country, community-based organizations across the country, providing them with goods and service to help families thrive. Prior to coming to the Good+Foundation, I was a program director for one of the community-based organizations in Los Angeles, working with fathers. And I worked with about 1,000 fathers per year, and about 90% of them came from child welfare, were referred to me in our program from child welfare. Done some great work, really provide fathers with some tools and parenting, but noticed early on that all of the tools in the world weren't helping them if they were released back into systems that had structural racism and or were not very father-friendly. Since then, I've had the opportunity to join in my current role, where not only are we providing services and training to community-based organizations, but I also partner with child welfare agencies across the country to help them improve their father engagement. And again, I realize that there is some strong structural racism that prevent families from reunifying in the way that the child welfare system is intended or says that it's supposed to be. So I come today as an advocate for change and or abolishment of the current child welfare system. It's not only professionally, it's personal for me. I have an adopted son that I had to navigate the child welfare system in all of its craziness just to be a foster, or actually an adoptive parent of a child who was in need. And I could tell you some stories about my process navigating that system as a professional with lots of privilege. So what guides my work is those who, similar to the keynote, similar to those who don't have that privilege, right? I am one that I think have a voice and can help reimagine this child welfare system to benefit the families that I know that are in need. So thank you for having me. Look forward to the conversation.
So last, certainly not least, Joyce McMillan.
Hi, good afternoon, everyone. Everyone else's sentiments, same as mine. Thank you, upEND, for putting this panel together and this day together. I've really enjoyed viewing thus far, and I hope to be part of a very great conversation with my two colleagues, Tymber and Alan. So I started JMAC for Families and PLAN, which stands for Parent Legislative Action Network in New York, after spending time as a director of a non-for-profit that I learned, that taught me a lot about the non-for-profit industrial complex. And I hope that becomes part of our conversation today, as what I have understood through my personal experiences is that these industrial complexes and foundations who support CPS with all of this money for change is only strengthening the harm that they are doing, and they need to revisit that, just as we need to revisit many other things. I came to this work because I was impacted by child welfare from the time my youngest child was born until she turned 18 years old. And so CPS has only been out of my life consistently for the last 3 years. And now it's time for me to jump into their life and show them what I'm made of and what they've helped to create. Change is coming.
Thanks, Joyce. So let's just get right into it. What does a social movement around abolishing the child welfare or family regulation system mean to you, and why is this work important? And this question is for everyone, but for ease, I will start with Tymber.
So when I think of abolition and how it relates to the family regulation system, the first word I associate with it is listen. Listen to the people that have been harmed. Listen to the communities that are saying, give us back our children, that are quite literally jumping through hoops to get their children back, but still being denied. It means listening to the LGBTQ plus children that are overrepresented within the foster care system. It means prioritizing their safety. It means prioritizing the well-being and the development of Black children. And I believe it's so important. Yeah, I just believe it's so important.
Thank you. Alan? You're on mute.
I look at social justice movements, right? Social justice movements are based on the concept of human rights and equality and equity, right? And they work to prevent marginalized people from preventing the marginalized people in society for being unjust policies being applied to them that contribute to oppression and oppression in society. Right? Instead of critically examining the racial disparities and things that normalize the foster care and child welfare system, its current practices actually, label bad mothers and fathers as violent and mistreat their children, right? As a whole, that doesn't represent the families that I see and work with on a daily basis. So it's important to me to address the rights and equity of children and families by any means necessary, right? And even if that means abolishment, right? So be it, right? Continuing with status quo is no longer an option. So abolishment to create and reimagine new ways of supporting families while, like was said earlier, while dismantling the broken policies that reinforce racism and disproportionality, I'm all for it. I'm in the seat ready to serve.
Thank you. Joyce?
What it means to me is creating the change that this country has resisted for decades, for centuries now. And that's what it means to me. It's not limited to child welfare, although that's where my focus is, because child welfare has intersections to housing, education, employment, mental health, prenatal health, postpartum health, and everything else that exists impacts Black Americans and people of color differently than it does our white counterparts. And so I'm here to talk about how it all intersects with child welfare and to educate people so that they will understand how to make the change. Because when we go in saying we want to fund CPS another $200,000 in hopes that they get it right this time, that's not how you change child welfare. That is not how you make any significant changes that trickle down and support my community. We need to stop giving this money to these governmental institutions and start putting this money in the community. And after completing my fellowship with Law for Black Lives, I clearly understand the concept of divest and invest. And I'm into investing in our community, and I'm going to tell you how we can do that.
Thank you. So I think that each of you sort of alluded to a similar thing. Tymber talking about the importance of listening, Alan talking about, you know, the structural racism within the systems, and Joyce, you really talking about, you know, why do we continue to put these efforts into systems which are producing racist outcomes? So that gets us into my next question, which is, you know, how did you arrive at abolition? I think a lot of us, you know, might have started in this work as not maybe being explicitly abolitionist, and it's sort of an arriving and as Ruth Wilson Gilmore says, a becoming an abolitionist. And so I would love to hear about how did you arrive at abolition?
So for me, I came to the child welfare work totally ignorant, right? I was running fatherhood programs and noticed that fathers who had lost custody of their children were involved in the child welfare system. And this was a system that was designed to promote well-being of children and ensure safety and all of those things that they talked about before. But I realized, again, early on, that after partnering with the child welfare system for some time, I started to see the racism that was rooted in the system itself. And I'm glad that they pointed out earlier that the child welfare system is more than just CPS or the entity itself. It involves the court, CBOs, mental health providers, substance abuse providers. It's a system total, right? And so those systems that all work together to make up the bigger child welfare system was not able to function in the way that the papers say it, right? The way that I read it and learned in school, right? And so I arrived here by witnessing injustice and harm being brought to families in ways that wasn't imagined as how I was coming to work at the table. I work with disproportionality groups and commissions within child welfare. And I want to be clear that there are some people who really care about children. But those people work in systems that are more concerned about policy and money. And policy and money that don't meet the clients that I work with in the space that they're in, right? These systems sometimes can't be trusted. They don't serve the people that they say they do, right? And they destroy families and children simply because they have the power and the policies to do so. You know, not to bring religion into it, but you know, I'm a Baptist boy, born and raised, right? And you know, I remember, you know, throughout my time, my grandmother and my mother saying that we're supposed to speak up for those who can't speak for themselves, for the rights of all people to thrive, right? So speaking up and judging fairly and defending the rights of those in need is something that I've always done. And now that I see that the policies that are in place that are supposed to help the people that look like me don't, then I have an obligation, I think, to reimagine something different, right? And while keeping in mind, because I wasn't with abolition at the beginning, right? I just want to reform and make it good, right? But after 12 years of work and after 12 years of seeing people jump through hoops and do what I was going to say the master, okay, the master says do, and still not get their kids, we got to, it's something, we got to go different, right? Something else has to happen, right? And so I've started to research and understand the definition of abolition, right? And we need to abolish the current child welfare system and reimagine and create something that works for the people, because this ain't.
So I came to abolition after I realized the safety mechanisms that have been put in place by systems. So as an example of a safety mechanism, if you get a call called on you and you go on the state central registry, they utilize the word indicated because they're not a judicial system, right? And so they got to use the word indicated, but it has the same impact as very similar to a felony conviction on the criminal side. But when people hear the word that you're indicated, they don't understand the ramifications of that. Now, me, I just said my youngest child is 21. My children are at childbearing ages. If my children were to have a child and need me to be a resource, I could not. The safety mechanism to put the next generation in foster care, right? Highlighting recidivism, but blaming it on me, saying that somehow I was unworthy or incapable of, when they have this backup mechanism that's invisible to people's eye. And when I looked across the board at these mechanisms, these backdoor mechanisms, I understood that you cannot reform a system that has these safety things put in place to prevent real change. So I decided the only thing to do was to dismantle it. And that's how I came to abolition.
I came to abolition as someone who grew up in the system. At the age of 12, I came out in my foster home, and I was shamed. For the next 4 to 6 months, I experienced discrimination and harassment. I was kept from the other children and told that I told very negative messages about myself. I reported it to the system many of times. I told my caseworker, I told the judge, I told everyone and anyone that I could talk to, and no one listened. For 6 months, I experienced unspeakable harm and abuse, to the point to where I felt that the only way out was to take my own life. No child should ever feel that their life is over because the system has removed them from home. Who holds the system accountable when children like myself experience this trauma? The system isn't designed to help children to grow into being thriving adults. It's designed to do the exact opposite, to funnel us into poverty, back into poverty, to funnel us back into the prison industrial complex, funneling children into human trafficking. There are so many holes and so many injustices that happen in the system, and so many people just overlook it. And it's just been okay. Within advocacy, it's also the same. People are so, wanting to be friends with everyone, or wanting to be okay with the money, be accepting the money. I don't understand how national foster care organizations, organizations that are designed to advocate for the welfare and the protection of children, don't from the jump have a public stance on protecting LGBTQ+ foster children. It's unacceptable. And for too long, that's just been allowed, and it's still being allowed in many of states. There is no accountability. There is no system of accountability. And so while we have this discussion about what does abolition look like, children are not safe. Families are not safe. And so I arrived to abolition because I truly believe the system is working how it's designed to work. And to fix it, we must abolish.
Thank you so much, Tymber, and to each of you for sharing your perspectives. Something that comes up with abolition a lot, especially with this system, is the idea that it really functions as a system of surveillance for families, for the children and the youth that are within the systems. Could y'all speak a little bit more to how the system functions as really a surveillance and policing systems for so many families?
Oh, I was gonna say I'd love to, right? We know that families of color are more likely to be surveilled than those who are not, right? And because they don't have the capacity to do it themselves, we rely on police, teachers, mental health professionals, who all come with their own, as Alan said earlier, they come with their own bias, right? And so decisions are made on families based on the reports of these individuals with their bias and their racial stuff that they bring to the table. That's written as gospel, right? I've sat in courts with fathers and mothers with families, and the judge reading the police report, and you can hear in the report the bias on the officer, but the judge is reading it like it was the Holy Bible, right? And so everything and the perception of that officer has now become fact. And now there's a cookie cutter case plan made for this family that doesn't fit their family, right? Detention and removals are made where there's no safety issue. But because the cookie cutter approach says you have to go to parenting class and submit to your analysis test, we have individuals doing things and jumping through hoops that basically are setting the stage for them to fail. Because you want me to go to parenting, because you want me to go to substance abuse and DV and all of the list of things that are in this cookie cutter approach, and work and see my kids and check in with my social worker, most families are not able to do that. And the moment that they drop the ball on one of those, they're considered non-compliant. And what happens to non-compliant people? The children stay in the system longer, not because there was an additional safety factor revealed, but just because you didn't do what we said, which was originated by the surveillance and the bias of somebody else. Our families are still torn apart, right? And I like it how it said earlier, I don't know what the solution is. I don't have all of those answers, but I have some questions, right? Why are we making these families jump through these hoops that are not prevented, that are not a result of child safety issues, right? I am all for child safety issues, and I work with a lot of people who promote and are in the department, right? I come with from a unique place because I'm a community activist, but I also stand aside next to social workers and administrators around child welfare work, right? And I call them to the table quite frequently. I'm known as the guy, he gonna say what he want to say, right? But even that, those people are not decision makers. Those people are not policy change makers, right? They're workers, right? And a lot of them subscribe to the surveillance because they're in fear of losing their job, right? I don't want nothing to happen to these children and under my watch because I'll lose my job. Well, that's not how we should be operating. We should be operating what's in the best interest of the family, right? The best interest of the children, not how do we keep our jobs and how do we not prevent from getting in trouble or being on the news. So surveillance plays a big part in how our families navigate these systems.
We do not operate from the aspect of what's best for children, because we operate from a white supremacist standpoint, which is how do we keep these other people who are non-white in line? How do we prevent them from being better, stronger, right? And so everything they do speaks to that. When we talk about surveillance, we can't just, again, look at child welfare. We have to look at why are Black children suspended while white children get extra time in school, right? They say you're going to stay after school for that because they want to invest in that child and they're not interested in investing in ours. We know that this system is not working. Anyone who sat here today throughout this panel knows what the data is. So my question is, if this system is so great, why was it built to look just like the mass incarceration system? Children are strip searched under the guise of checking for marks and bruises. It's like prisons are strip search. They're both removed from everything and everyone they know and love. They both have set visit times on set visit days. They both have oversight during the visit. And we're not going to take up the time with the gazillion other things, but at the end of the day, they're both paroled back to either the community or to their families, and they both have oversight during that parole period, and they can both go back for any minute reason, infraction, or whatever it is. So you're telling me that you built a system that was there to protect children, that is built on the same premise as a system that tortures adults. And then we have to look historically where the prison system comes from. It derives from the slave catcher, right? So we are still in this same situation, but it's being called by something different. A few years ago in New York, the Bloomberg administration had the now failed stop and frisk policy, where they said to keep guns off the street, they had to stop and frisk people randomly to pat them down and make sure they weren't carrying anything they should not carry. It did not prove to keep the community safer. What it proved to do was to bring more people under surveillance, have more people fingerprinted, more people's picture taken, and held in some type of database or catalog of another Black person to be suspicious of. It didn't reduce anything. It increased the surveillance of us. The same thing the school system does. We have to think about these systems and the relationship to the jobs they employ, like the mandated reporter. CPS agents say that they partner with different organizations so that they can keep children safe. No, they partner with other agencies so that they can surveillance more families. Everyone who CPS partners with is someone who that family should reasonably be able to go to and ask for help and or support. But because of them being mandated reporters, that always turns into people being fed into a system that they call child protection, when the only thing they protect children from is success. And I like to say one last thing. We all know that the only way that Black people get into something that's worth having is through affirmative action. And I don't see affirmative action happening in any of these systems. We going kicking, screaming, and fighting.
Yes, kicking, screaming, and fighting. Some of the ways that I understand the policing that happens by the system is by understanding how it happens to children once they're in the system, once the rights have been terminated. When I say that the system isn't designed to raise children, I mean people within group homes aren't trained to raise children that are neurodivergent. They aren't trained to handle children with mental illness. And so now we have all these children together, and so they're more prone to anything that happens when children interact. For instance, when you have siblings that are together and they fight, you sit them down, you have a conversation, or you do whatever needs to happen to walk back that situation. When it happens in the group home, police are called, charges are pressed. And so now this 14-year-old child who got into an argument with their peer over a pencil, over dinner, over something minute, is now entangled with the system for the rest of their life. And they now have a record that continues to build, because every time that something is done, rather than being trained to handle it, they're trained to call the police. They're trained to call a higher level of care to control the children. What that looks like is the over-medication of children when they're in the system. There are a lot of children that have a variety of needs in terms of medication. But we know that that medication in general is used to suppress Black children because we tend to be more outspoken, more resistant to the oppression that we experience within these placements. And so what happens is we're pumped full of this medication, and then when we age out of the system, we have a number of like varying issues, and I'm talking in circles. Yes, the policing that happens is unjust, but it's allowed to keep going because we continue to utilize and uphold the system.
Yes, thank you. I think so much of what each of you have shared is that not only we know that the system is working as intended, and that is to really police, surveil, and oppress communities, but also that, you know, there's these narratives around the system that perpetuate the belief that it is a protecting system, that it is a helping system. And so much of what y'all have spoken to is the ways in which the system is not protecting. It is harming, it is fragmenting communities, it is, you know, really destroying the fabric of so many families, of so many Black families. And so I really appreciate that important and insightful reframing of what the system does. We have a lot of audience questions, but before we get to those, I just want to ask each of you if there are 1 to 2 things that, you know, that you want folks to carry away about this conversation around abolishing the system, what would 1 to 2 things be?
Go ahead, Joyce.
I would say to stop investing in this system and start investing in building something to replace what already exists. I think it is a waste of our time to try to untangle this system. It's too entangled. It cannot be fixed. The safety mechanisms go deep, generations deep, and you will never be able to untangle it. You have to start fresh. As we dismantle pieces, we have to be putting pieces in place. I do agree, there are children who need supports, but the supports we provide to children and or families who need assistance should not look like what it is we provide, because that's not it. Surveillance is not support. Poverty is not neglect. You want to know how to reduce the system? Let's begin by stopping the thought process that we don't know how to untangle the confusion of, is it poverty or is it neglect? Mama ain't got no job. Daddy's in jail. Mama didn't finish high school because she was a foster child. All of the non-parenting skills she has, she learned in the foster care system. You know that's poverty, because you know that's what your system sets people up for. So stop it. Just stop it. Stop acting like you don't understand, because you understand clearly. Now it's time for change. Start investing your time and your energy in creating what really works, because we can't fix what's already here.
Thank you.
Yeah, for me, I think I have 2 takeaways. The first is that we must realize that Child Protective Services has become less about the child and more about punitive actions for parents, right? And that's shown in the removal of children when there's no child safety issue, right? Children deserve better, right? We gotta get to a place where prevention, Alice spoke on it earlier, we gotta work more about prevention. I would like these dollars and time invested in providing these families with challenges, some education and some parenting tools prior to them coming into it, prior to you taking away their kids, right? So where are the programs within the communities and in these community-based organizations that get these huge contracts, millions and millions of dollars, but in their contract, they only do what the system that's broken tells them to do, right? When are we gonna start allowing community-based organizations to operate in a way that the community needs, right? So where are the free parenting classes for parents who, you know, this is my first time being a parent and I don't understand anything other than whoopings? Where's the free class before me going into the system and then you charging me for a class that I have to take after my child's been taken away, right? Where are the systems in place that are ran through child welfare about stress and management and trauma prior to me getting my child taken away and then now having to take an individual therapy class because I'm stressed out as a parent, right? How do we help prevent kids from going into a system that doesn't work first, right? How do we allocate the dollars to those community-based organizations that they know what works in their community, but what we know is that they're not doing what works in their community because they're beholden to the contracts and the money in the way that the community, the child welfare system says you have to operate. It says you have to be evidence-based, based on systems that don't look like the people that you're working with, right? I don't need a system, an evidence-based program that tells me that was tested on children in South Carolina, in rural South Carolina, and I'm working with children in the inner city of Watts, right? How do I get programming that reflects the brown and Black people that are in my community? That's my takeaway, right? It's time to pull back the curtain and let our families free, right?
Yes, thank you. Tymber?
Well, one of the takeaways I want to share is a quote from Dr. Dorothy Roberts, the author of Killing the Black Body, who is a renowned activist and movement worker. This is from their book, Shattered Bonds, The Color of Child Welfare, page 99. The opening passage of Children of the Storm still rings true today. The racism that characterizes American society has had a tragic effect upon Black children. It has given the Black children a history, a situation, and a set of problems that are quantitatively different from those of white children. In a narrower context, American racism has placed Black children in an especially disadvantaged position in relation to American institutions, including the institution of child welfare. In the 3 decades since the book's publication, the position of Black children in child welfare system has not improved. In fact, child protective services have become even more segregated and more destructive. As the child welfare roles have darkened, family preserving services have dried up, and child removal has stepped up. Child welfare reflects the political choice to address dire child poverty in Black communities by punishing parents instead of confronting the structural reasons for racial and economic inequality. It is time to face the inescapable reality. America's child welfare system is a racist institution. And as long as we continue to allow it to exist the way it does, it will still be a racist institution. We must listen to the people who have been impacted by this system. No longer can advocacy be led by white lives and white people who have been impacted by this system. Black people can't be pushed out of advocacy. People with lived experience can't be pushed out of advocacy. We can't be belittled by not having a degree or not having a certain form of education to speak to the issue. These are people who have spent their entire lives oppressed, silenced, harmed, neglected by a system that promised to protect them, that promised to reimagine this new life. And so in this new age or this new movement, it also means aggressively prioritizing and listening to the lived experience of people.
Yes, aggressively prioritizing. I love that. Thank you so much for that. I think that, you know, when you think about racist research and then when you think about the research that really moves us forward and pushes to abolition, at the top of my mind, at least, I know it's definitely Dr. Roberts. So thank you so much for bringing that into conversation. I think we have some audience questions that should be popping up. So we have a question from A. Jawitz, which is, what are you most proud of? What examples of steps toward abolition give you the most hope? And so why don't we start with Joyce?
Okay. So for me, I'm most proud of being smarter than all of the people who work within the system that have PhDs with my little 8th grade education and my GED, because they don't know it, but I do. The child welfare system is a fraud. They don't understand it doesn't work. And so I'm just really proud to say that I know more than them, even though they're getting paid a lot more to be destruction agents of families. What examples and steps towards abolition give me the most hope? Legislative changes, organizing families who've been impacted, whose voices have been marginalized along with them and their experiences. Unfortunately, many times families who try to have a voice, they end up being co-opted by some white person who really does not want to see change. If they don't stop porno pimping stories of families of harm, I don't know what I'm going to do. I don't know why we fund organizations that are allowed to re-traumatize people with the storytelling thing that they do. It's not helpful. It's not helpful when we tell it from the position of what we as parents have done wrong, because we already know we're not perfect. We're not talking about whether or not we're perfect as people or as parents. We're talking about not what we did, but how you helped us to resolve the problem that we were having. And that's where we need to focus it. So I've passed legislation this year that reduced the time in New York that a family will stay on the state central registry. It used to be until your youngest child turned the age of 28. As a derivative, if you had a new child, you went back on that list and your time on that list started over again. Essentially, you were on that list for a lifetime. And again, when we talk about how this indication being on the list has very close similarities to a felony conviction, it blocked people from housing, jobs, and other necessities. I am also working on legislation to ensure that people are Mirandaized when CPS comes and knocks on their door in New York City. Families need to know what their rights are. If you ask the CPS agent what your rights are, they have no idea what that is, because they operate without the thought of us having rights. The other thing I would like to do is get my second legislation passed where confidentiality, instead of anonymous reporting, it would be confidential, meaning you would have to leave your name and contact information. It wouldn't be made available to the person you're calling on, but it would give some transparency in clarifying what the caller said and not just leaving it up to CPS. Everything seems to be left up to CPS, you know, and it's too much. And it creates the problem that we have today. And this is why we need to dismantle. Foster care agencies should not be paid for and hired by CPS. Parent advocates should not work for CPS. All of these things should be separate and apart. And it's going to bring clarity, transparency, and it's going to slow the process of people entering the system. And as long as we slow the process of people entering, we'll become closer to that abolition as we shrink, gone.
I am most proud that I have stayed true to me. I am most proud that I continue to be intentional in the work, right? I haven't sold out for no job that's going to give me a great title. I have, I continue to listen to the people that I'm supposed to be serving and working with, right? And hearing where they are from their standpoint, as opposed to administrators and or people who it's in the best interest and in their best financial interest for the people to stay where they are, right? So intentionality is something that I'm extremely proud of. And I'm also proud, though, that I'm not a finger waver, right? I'm not just saying bad, that I have the wherewithal to work alongside some of those people that are in those systems, because we're not going to do it all from the outside either, right? We need a whole bunch of people from the inside to say yes. And I hear them all the time. We know you're not working. Yes, this system's racist. These are people on the ground working, right? These aren't the honchos with the big paycheck. These are the social workers and the case managers, right? They will acknowledge we need them to continue to advocate from the inside while people like us advocate from the outside. Together, I think we'll be able to dismantle this system that doesn't work.
I am most proud of where I am currently. In my current position at the Hugh Lane Wellness Foundation, I am the manager of strategic initiatives. And a big part of our work is working to improve the health outcomes of LGBTQ+ youth and families. And so a lot of that work intersects with the child welfare system. We provide direct consultation to social workers within Allegheny County. We consistently do SOGI trainings, SOGI, sexual orientation, gender identity, and expression. And so we consistently build different interventions and programs that allow social workers to interrogate their own bias and build the supports that they need to support LGBTQ+ youth that are within the system. This same kind of transformative support can be replicated anywhere. All that you need is steps towards abolition that give me the most hope is really the the now listening to of people with lived experience and us being pulled to the forefront of the movement. Abolition has to include us, it has to listen to us, and we have to lead it. We and families who have been impacted have to lead it. And yeah.
Thank you. So we have one for you, Tymber, which is, what are the ways in which system-involved and formerly system-involved people can best contribute to abolition?
I believe the biggest contribution that we can make, both system-involved and formerly system-involved people, to best contribute the movement is interrogating our own selves. Abolition requires us to interrogate our own beliefs and our values. It requires us to unlearn things that we've been taught, things that have been forced upon us. And I believe in this time, more than anything, our biggest contribution is focusing on our own healing. Because we know that once we exit care, that's not the end of that experience. It follows you for the holidays. It follows you every day of the week. It follows you when someone in the grocery store is with their family. And so ways that we can contribute, again, is really focusing on our own wellness and finding our own entry into the movement. There are a number of ways to be involved in the movement. Not all of them are being in the front. Not all of them is being in the back. But we have to be given the resources to figure out what that looks like.
Thank you. Joyce, I want to take a minute to also throw that question to you. I know that you as a parent have experiences, and what does it look like for a parent with experiences in the system to be involved in this movement towards abolition?
First, I think you have to lack the being intimidated factor, because I find people who think they are allowed to talk down to me for several different reasons. They may know that I don't have a college degree. They may know that I've been involved in systems. They see the color of my skin. They know that I am a Black woman. That's the mistake they make when they allow those things to misconceive and guide how they interact with me. Because being a Black woman, not having a formal education higher than high school, and the other things that they may look at, does not create a situation where should be submissive to you in any shape, form, or fashion. You may bring professionalism, as people like to call themselves. I bring expertise. And so let the expert meet the professional, and let me show you that the expert can also be a professional. And you can join me in making this change, but you will not lead me. You can support me, I will guide you. You will not guide me, because we're in this situation because you have been the one guiding for a very long time. And look at where it has gotten us. It's gotten us nowhere. Where families are destroyed, communities are destroyed, our future generations are looking at being destroyed on the recidivism that they have set up. I don't want no more of what it is you're serving at that table. I will prepare my own, and you can come sit over here and learn from me.
Thank you. Yes. What else is there to say? I think that we have one more question before we wrap up. So what work is being done to center impacted people's voices in the movement for reform and abolition, and is it enough? Go ahead.
Now, I can't speak for everything that's being done because I'm not aware of everything, but I know that within policy, there are a lot of organizations, ones that I won't name, that are essentially creating different like youth advisory boards and like youth councils and like different ways of engaging people with lived experience. Through this, we are continually traumatized, still belittled, invited to be on panels for $25 cards and then sent back to homelessness. And so there are a number of situations and ways that we are included. And I think there are a lot of positive things that have happened. That's why I'm focusing on like the things that are specifically not as positive, because they are more common for Black, Indigenous people of color who have lived through the system and then returned to advocate and work within the system or on behalf of the system. So I would say, no, it's not enough. And we have to do more. Doing more means investing in people who have been impacted by the system, and not investing on your terms, investing on their own terms. So making the money available and allowing them to understand how to best use it for themselves, because we're capable of that. The same way that you all have ideas and programs that you want us to be a part of and you want us to lead, we are capable of leading those as our own individuals, as an entity. And so how about we focus on allowing us to build the creative power and the collective power to run and operate these programs, rather than bringing us into the organization to regulate and control our messaging of how we tell our story or of how we advocate. There's no wrong way to advocate when the system has wronged you. We have to find what that looks like. And yes.
Go ahead.
I want to start at the end of the question. No, there's not enough being done, right? And I think that the impacted individuals are being silenced, right? I know in the families that I work with, they can't speak out about how they're being impacted because the detention will be that much longer. The consequence to the social worker is far too high for their voices to be heard. So that means that those of us those of us who are both in and out of the system have to lift up the voices of those who can't, right? And it's one of the things that I do in my work with fathers, right? A lot of them are under a lot of scrutiny from the department itself across the country, and they can't say what they want to say. So as an advocate of someone who understands the system, I get to speak for them. So their voice is being heard, but not in the way that it needs to, and it's certainly not enough. We need to create spaces where there are no repercussions for me saying, hey, I don't like the way the social worker talked to me like I was a boy, right? I don't like the way that I've been made to jump through hoops without fear that now my child's going to be in the system that much longer, right? Those voices need to be heard more, and they're not enough.
Thank you. Joyce, go ahead. It looked like you were about to say something.
It was on the tip of my tongue. Yes, I want to kind of respond to what my colleague just said here, because I don't believe in creating a space for people to say what they want. I believe people have to say and do what's right for them because it's the right thing to do. And when we're careful about what we say and do, then we're giving the other person power to continue their behavior. And when we talk about how professionals support the experts, one of the things as professionals that has to stop happening is we have to stop acknowledging what we know the system is doing wrong. So I know attorneys, not all, but I know attorneys, social workers, and others who say to clients, it's only going to be more tough on you if you do that. If you push back, you can. What you're saying is true. But if you do that, why can I not speak the truth? And you stand up and tell somebody, I saw you retaliate because she spoke the truth. Because change comes in numbers. And so, of course, I can't say what I need to say if you're only going to say, I told you they were going to retaliate, and you're not standing up and helping me to point out the fact that they did retaliate. So let's not tell the person to be quiet. My dad used to say, because I was the youngest of 5 kids, and so I would say maybe I was pushed around in the house, but I squealed. Every time somebody pushed me around, my dad would say, who is bothering that child, because I'm sick of her squealing. And so I squeal today. When there is an injustice served upon me, I squeal. I will not be quiet. I don't care what the consequences are, because they're mistreating me, because that's what they want to do and that's what they have the power to do. And they will continue to mistreat me until I stop them. Bullies don't stop beating you up until you fight back. And so I'm not going to allow you to intimidate my family, traumatize my family, and me sit there and wait until you're done. I'm fighting back. And you should support and tell all your other friends to support me doing that. Thank you.
Thank you. So I think we have just one last question, which I know I said the last one was the last one, but this is the last one. Which is, how can those of us working within the child welfare system support movement towards abolition while also being employed within that very system?
Doesn't work. It doesn't work. I'm not saying that we can't make changes from the inside or that we don't need people from the inside, but people who have much more power than parents who have been impacted have great difficulty themselves. So a person who is intimidated already by the system and who already feels marginalized and already feels afraid to speak up, they're not going to have enough power to make any changes. What they become is what I call back rubbers. And it's not any disrespect to the parents who work within systems, but to get their paycheck, this is what they're asked to do. Their job, when parent advocacy was created about 25 years ago, it was created to strengthen the system. It was created for peer-to-peer. Parents to tell other parents already been through this, and if you want to make it through and possibly get your children back, I say possibly get your children back, you need to rub her back and tell her to cooperate. Tell her to do what you did so that she can get through this faster. I'm not about that life. I'm about, you wronged me, I'm telling you you wronged me, it's wrong, and I'm standing up and telling you it's wrong, and we will duke it out until the end. And I will tell you, I did not comply with the ACS and their services when they removed, my children. I did not comply, and I got my children back. And when my children were older and ACS came involved, I didn't even respond to their court order. I did not go to court because I realized this is a rogue system and I am not going to give them my time. And if more people start standing up, I think change will come sooner.
So I agree with Joyce, but I also think that there is a role for those in the system while abolishment has happened with those from the outside, right? I have several people that I work with across the country that will tell me, email me, text me, hey, this is something that you need to know and say that in my position, I can't, right? And I'm not saying that they're behind the scenes, but the reality is that they're trying to feed their kids too, and I get it, right? To Joyce's point and her statement earlier, Joyce, you are a freedom fighter and I love you. I don't think everybody has the that you do. There are a lot of people, and I say this from a place of privilege. I too would fight back, right? But I work with a lot of families where they don't have that option, right? Because they don't have a support or they didn't have the wherever you get yours from, they don't have that in there. So that it'll take people like me, you, and people from the inside to help those families as we continue to abolish a system that doesn't work.
Mine is kind of very similar, a little bit of both, actually. I want to vary on the side of you have to ask yourself, how much are you willing to sacrifice, or what are you willing to sacrifice to ensure the safety of children and families? I, as an individual, am not okay with over-regulating Black families. I am not okay with turning a blind eye to the abuse and the discrimination that happens to children within the system. And so in a way, I have understood that I am incapable of working as a direct tool of the system while working to abolish the system. My entry to abolition has to be for my own framework, has to be for my own understanding of organizing outside of the system and understanding how to best, I guess, organize on behalf of those who are unable to speak, who are quite literally oppressed. Yeah, what are you willing to sacrifice? Every day, people sacrifice things. Parents sacrifice their jobs to go to parenting classes. Youth sacrifice their safety because they're literally unsafe in their current placement, and so they'd rather sleep on the street. What are you willing to sacrifice to ensure that they don't have to make this impossible decision?
Thank you so much, Tymber. I don't think we could have ended more perfectly. What are you willing to sacrifice? I just want to express my extreme gratitude for each of you, for each of your thoughts and experiences today. This has been amazing, and I felt like I've learned so much and my heart is full. So thank you so much, and everybody, please join me in thanking our wonderful panel.
Thanks, Maya. And thanks everyone for hanging in with us for today. We asked for frank and candid conversation, and I really think that happened today. And I want to thank you all who have been participating with us. We see your comments, we see your questions, and we're excited that you are connecting with each other virtually, sharing resources, and challenging each other. If this had been an in-person event, we would have hoped that people would have connected and been able to talk more with each other. But because this is a virtual space, we hope that you are able to find one another and continue to learn and connect from one another. Tomorrow is another exciting day, we hope, with 2 panel discussions. We're going to begin with a discussion with leaders in Indian country, talking about their efforts at restoration of tribal connections and tribal values. And the second panel is focused a bit more on the road to abolition. It's with leaders pushing for better evidence, better policy and practice within the current child welfare system, and what would a road to abolition mean and look like. So thank you all, and we look forward to seeing you back here tomorrow. Take care.